Today we are talking about dental tools and instruments. Just an overview of what we're going to do today. We're going to explain the structure of a tool, overview of the range and function of different tools, and the procedures that ensure that the tool is kept hygienic.
Okay, so first, the structure of a tool. Most tools have three parts. The first is a passive part, which is a component that doesn't directly engage with the patient's mouth, but it has grooves and stuff to provide a grip. And it can vary based on shape, material, that kind of stuff, based on what it's going to be used for. Then you have the intermediate part, which basically forms a bridge between the active part and the working part. Between the active part and the passive part. And it can be different shapes, it can be either straight or angled, etc. And last you have the active part, which is just the working end that actually goes in the person's oral cavity and performs the function. That's most instruments. However, sometimes you kind of simpler ones, which only have the passive and the active part, and they're just connected by an axis of rotation, such as scissors. There's different types of instruments, and they can be categorized into different sets. So they can either just be for examining the mouth, or for actually cleaning it and scaling, or it can be for removing cavities like extractions, or placing materials such as fillings and that kind of stuff. So one tool that's basically always used is a mirror, which is basically a handle connected to a mirror made of a reflective material, such as glass or metal. And it has different uses. So first of all, visualization for places in the mouth that you can't see directly, so the back of your throat or behind your tooth and stuff. And then there's also light reflection. So it's used to illuminate the person's mouth by reflecting the overhead lights, the big ones on top, so that the dentist can have more accuracy when he's performing the procedure. And there's also retraction. So you can retract soft tissues in the mouth, such as the tongue and the cheeks, just to, again, improve visibility. And then lastly, it can also be used to show the patients what's going on so they feel more comfortable. And another thing is a saliva ejector. So it's just used to remove excess fluids such as saliva, blood, water. It consists of a flexible tube and then a suction or a vacuum system. The tube can be made of plastic or silicone, and it's placed at the back of your molars, which are right at the back, or on the sides of your tongue. And it's used to provide a clear view for the dentist, as well as to prevent saliva buildup, because that can cause discomfort to the patient, and lastly to control any infection.
Okay, the next tools are scalers and excavators. So they're both different in the fact that scalers are used for scaling. So over here you have a tooth and you have plaque below the gum line, and a dentist uses scalers. They can come in with different heads, and a dentist uses them to remove any plaque or build up. And there's various heads that attach on to the end of it, and they're for different uses. So for example, there's a sickle scaler, which is this one. It has a sharp point and it removes calculus above the gum line, so more in this picture over here. And then there's a curette, which has a rounded end and it removes calculus below the gum line, so the dentist would go below around here and remove it from there. The next one is an excavator, which has a bit of a ball at the end of it, and that removes infected dentine from cavities to prevent any cavities from progressing. And you can tell the difference of the infected dentine and the normal one by the texture that you have. So over here you have this yellow part, dentine, which is more soft and mushy. So a dentist will tell apart by what they're removing by the actual texture of it. And the next one is a pin and ligature cutter, and it's normally used in orthodontics. So you have braces, and an orthodontist usually uses these to cut maybe the ends of the wires over there, so they don't stab into your gum in the back, or your mouth in the back. And they're normally tapered at the end. So if you see over here, they're normally tapered so they can get into the space behind. And then you have dental elevators, which are used before tooth extraction, and they're normally used to loosen the teeth. And so you have that. Up there is a picture of one, and you get different heads and different orientations, so you can get right ones and left ones. It depends on how you're removing the tooth and which side you're coming at it from. So normally you you have a tooth here, and normally you put the elevator into around the gum line, push it down a bit, and then rotate it like this, so that you can lift up the tooth with forceps afterwards. And there's a video that we can watch now if the sound's working. Okay, just skip ahead. It just shows you how to use it. I can share this with you afterwards if you want to watch the video. So like that, they're driving the elevators into the actual gum so that it loosens the tooth and it gets it ready for extraction. Yeah, that's it.
So this is an interproximal stripper, which is also used by orthodontists to remove some of the enamel between the spaces of the teeth. And this is normally done to create extra space for crowded teeth and create the ideal tooth alignment. So when you're putting on braces, it just makes sure that there's like no, it has the ideal arrangement. So there's nothing in between that can get in the way and make it like kind of wonky. And so here are some like chemicals and materials that are used. So you all know fluoride. Sometimes after procedure, the dentist puts fluoride over your teeth, which is like a varnish that prevents decay because it strengthens the tooth enamel and it makes it more resistant. And then you have fillings, which repair cavities caused by decay. The most common type of filling is dental amalgam, which is made of different metals. And amalgam is often used on the back teeth as they're hard wearing and more prone to damage. And finally, here are some procedures that are done by dentists to ensure that the tool is kept hygienic so that infection doesn't spread between patients. So you have reprocessing of dental instruments. So the instrument must be cleaned and disinfected after every single use. And this is done the best way of doing this is through a professional washer disinfector using an appropriate sort of detergent. And after this is done, it has to be visually inspected for debris. And if any debris is visible, it has to be reprocessed. The second is sterilization. So an autoclave is like a sort of oven that uses thermal disinfection to apply both steam and pressure to the instrument, and it has to reach a certain temperature and pressure for a certain amount of time for it to be considered sterilized. And then after that, it is packaged and stored, and it can remain sealed for 12 months. And unpacked equipment can be in a covered container for a maximum week. And if they remain unused for longer than this time, then they have to go through the disinfection and sterilization process again. And finally, you have dirty and clean segregation, where instruments that are clean are locked separately from instruments that are dirty, which is standard hygiene procedures. Thank you for listening. Any questions?